Dr. Razook Fareedh, Faculty General Medicine with 9 years of teaching experience with 15 national and international journals to my credit and a monogram. Today we are going to be discussing on the topic bleeding and clotting disorder. We will go to the topic in detail. The classification, we have bleeding disorders and clotting disorders. Under the bleeding disorders, we have vascular abnormality disorders, platelet disorders. Under the clotting disorders, we have congenital, where we have the hemophilia A, B, von Willebrand disease, and acquired causes we have vitamin K deficiency, fibrinolytic disorders and drug induced disorders. What is bleeding disorder? Bleeding disorders are due to altered ability of the blood vessels and platelets to maintain hemostasis, may be inherited due to genetic transmission or acquired secondary to disease. Bleeding disorder, disorders of the blood vessel abnormality, qualitative disorders of platelet, quantitative disorders of the platelet. We will discuss about the disorders of the vessel wall abnormality. Disorders due to the vascular abnormality can be autoimmune, where we have allergic purpura, drug induced vascular purpura or and purpura fulminans. And due to infections, we have bacterial infection, where under which the meningococcemia, septicemia, typhoid fever, diphtheria, tuberculosis, endocarditis and bacterial products. Under viral, we have smallpox, influenza and measles. Rickettsia and protozoal also contribute to the bleeding disorder due to vascular abnormality, and under protozoal we have malaria, toxoplasmosis. And structural malformations, under which we have hereditary hemorrhagic telangiectasia, hereditary disorders of connective tissue, where we have Ehlers-Danlos syndrome, osteogenesis imperfecta, and acquired disorders of connective tissue, where we have the scurvy, corticosteroid purpura and senile purpura. In miscellaneous condition, we have the autoerythrocyte sensitization and related syndromes, paraproteinemias, purpura simplex and related disorders, purpura in association with certain skin diseases. We will discuss the structural malformation in detail, hereditary hemorrhagic telangiectasia, hereditary disorders of the connective tissue, where we will discuss in detail about the Ehlers-Danlos syndrome, and acquired disorders of the connective tissue, we will discuss about the scurvy. Hereditary hemorrhagic telangiectasia, it is also called as Osler-Weber-Rendu syndrome or hereditofamilial angiomatosis or Osler's disease. The syndrome characterized by autosomal dominant disorder and affects 1 in 5,000 to 18,000 people. Mucocutaneous, it is a mucocutaneous disorder characterized by arteriovenous malformations. And etiopathogenesis, we have the mutation of either one or two different gene of two different loci is responsible for the condition, the 9q and 12q. HST1 mutation of the endoglin gene on chromosome 9, which encodes for the homodimeric integral membrane glycoprotein, and HST2 mutation of the activin receptor like kinase 1 gene on chromosome 12. They are encoding for the surface receptor transformation growth factor beta. They are responsible for the condition. The transforming growth factor beta plays a role in tissue repair and angiogenesis. The mutation in the gene, development of abnormal vasculature, defect in endothelial junction and endothelial cell degeneration, weakness of perivascular connective tissue leads to dilatation of the capillaries and postcapillary venules, which results in telangiectasia, arteriovenous malformation and aneurysm. The clinical features of the conditions are, one of the earliest signs of the disease is the epistaxis, and bleeding from the oral cavity, and involvement of the oral mucous membrane. And further examination, we have the nasal and oropharyngeal mucosa exhibiting numerous scattered red papules of size of 1 to 2 millimeter in size. Spider like telangiectasia are present. They are associated with Crest syndrome. Systemic involvement: the hands, neck, chest and feet, gastrointestinal mucosa, genitourinary tract, conjunctival mucosa are also involved. The oral manifestation: the sites involved are the vermilion zone of the lips, tongue and the buccal mucosa, palate, floor of the mouth. There are scattered red papules are present in these areas. The diagnosis and laboratory findings: the criteria for the diagnosis: recurrent spontaneous epistaxis, telangiectasia of the mucosa and skin, atriovenous malformation involving the lung, liver, and with the family history, it is a criteria for the diagnosis. And bleeding time and clotting time are normal in these disorders, with severe bleeding and mild anemia and thrombocytopenia. The treatment: spontaneous hemorrhages we are treated with pressure packs, nasal bleeding, angiomatosis and telangiectasia areas are cauterized, treated with X-ray radiation and surgically excised. We will see about the Ehlers-Danlos syndrome. It is also called tenascin X deficiency, cutis hyperelastesia. It is an inherited connective tissue disorder, the genetic defect of collagen synthesis. It affects the skin, joints and blood vessels. It is an autosomal dominant disorder. Type 4 of the Ehlers-Danlos syndrome is associated with arterial rupture and visceral perforation. The etiopathogenesis: the subtype caused by mutation in gene coding for the collagen, type 1, 3 and 4. The mutation in the gene encoding for the enzymes involved in post-translation modification of 1, 3 and 5 collagen, type 1 and type 2. There is mutation in COL5A1 and COL5A2 and tenascin X gene. In type 4 Ehlers-Danlos syndrome, there is decreased amount of type 3 collagen. Type 5 and 6, there is deficiency of hydroxylase and lysyl oxidase. Clinical features of Ehlers-Danlos syndrome: the characteristic are the hyperelasticity of the skin, hyperextensibility of the joint, fragility of the skin and the blood vessels. They all cause easy bruising, defective healing of the skin. The young patient is often mistaken for the victim of child abuse. Life expectancy is reduced because of aortic aneurysm formation and rupture. These are the types: the Ehlers-Danlos syndrome type 1 and type 3. They have the feature of hyperextensibility of the skin and the joints, you can see in the picture. And Ehlers-Danlos syndrome type 4, there is ecchymotic type, rupture of large arteries and intestine. You can see the picture, the hyperextensible joints and hyperextensible skin. And other features are the hyperteliorism, wide nasal bridge, epicanthic fold, protruding ears, frontal bossing and bilateral bleeding in the cheeks. The oral manifestation, the characteristic is the Gorlin sign. It is present in the 50% of the patients. They touch the tip of the nose with their tongue, easy bruising and bleeding during minor manipulation of the oral mucosa. Hypermobility of the TMJ joint, repeated dislocation of the jaw. These are the other characteristic feature of the disease. In laboratory findings, we have a normal bleeding time and clotting time and abnormal capillary fragility test, that is a Hess test, Rumble-Liddy test. Next, we see about scurvy. It is vitamin C deficiency, also called as vitamin C, also called as L-ascorbic acid, is deficient in this condition, and water soluble. It is a water soluble vitamin. The richest source are from the vegetables, citrus fruits, most likely the fruits which are lemon, guava, orange and grapes are rich in vitamin C. The dietary intake, according to the National Health and Nutritional Examinations Survey, the infant should intake at least 30 milligram per day, and in adults 60 milligram per day is of vitamin C intake is essential. Deficiency of vitamin C causes scurvy. Scurvy was first described in the 5th century by Hippocrates. Scurvy occurs with the deficiency of vitamin C less than 10 milligram per day. If the intake is less than 10 milligram per day, usually the disease manifests. Severe deficiency of vitamin C causes sclerotic gingivitis. These are the oral manifestations. The interdental marginal gingival swelling. In severe cases, the gingiva is boggy, ulcerates and bleeds. There is a foul breath and loss of bones and loosening of the teeth. You can see in the pictures. The laboratory finding: increased bleeding time and abnormal capillary fragility test, that is Hess test, Rumpel-Levy test. Then treatment: in infants and children are usually treated with vitamin C at a dose of 100 to 300 milligram daily, and adults 500 to 1000 milligram daily for 1 month. We will see about the disorders of the platelets. The classification of the platelet disorder: one is we have the quantitative and qualitative. Under the quantitative, we have thrombocytopenia and thrombocytosis, and in qualitative we have congenital and acquired. We will see one by one. In the thrombocytopenia, it can be idiopathic, immune thrombocytopenic purpura and thrombotic thrombocytopenic purpura, and Wiskoff-Aldrich syndrome, heparin induced thrombocytopenia. In thrombocytosis, the following conditions: it can be a benign or reactive process or a myeloproliferative disorder. The qualitative disorders of platelets: the congenital, we have Glanzmann's thrombasthenia, Bernard-Soulier syndrome and storage granule abnormalities. And acquired, we have drug induced and acute or chronic leukemia, hemorrhagic thrombocytopenia and myelofibrosis and anemia. We will see one by one. The first condition is the immune thrombocytopenic purpura. It is also called Verhoef's disease or idiopathic purpura. It is an autoimmune disorder characterized by autoantibody mediated platelet destruction and decreased platelet production. Okay, Paul Gottlieb Verhoef in 1735 wrote initially report on the purpura of immune thrombocytic purpura, which have the acute and chronic condition. The acute, it is usually self-limited and most occurs in children, and it is due to viral infections, and its spontaneous resolution occurs in 2 months. In chronic, it is a common condition, occurs in adults, most likely in females in the age group of 20 to 40 years, and cause is unknown, and it is lost for longer than 6 months. These are the clinical findings: the spontaneous purpuric or hemorrhagic lesion, petechiae to ecchymosis, bleeding from the nose, that is epistaxis, bleeding in the urinary tract, hematuria, and bleeding in gastrointestinal tract, melena or hematemesis, and the complications like intracranial hemorrhage can occur. The oral manifestation: severe and profuse gingival hemorrhage, petechiae on the palate, contraindicates many surgical procedures. These are the laboratory findings. The platelet count will be below 60,000 and prolonged bleeding time. Clotting time is usually normal, and tourniquet test strongly positive. Next condition, the thrombotic thrombocytopenic purpura or Moshakovic's disease. It's uncommon form. It's a life-threatening multi-system disorder. It was first described by Eli Moshkovitz and is common in adults. It is associated with pregnancy, HIV, cancer, bacterial infection and vasculitis, bone marrow transplantation and drugs. The deficiency of the protease enzyme ADAMTS13 is responsible for the condition. TTP and hemolytic uremic syndrome are thrombotic microangiopathies characterized by microvascular lesions with platelet aggregations. HUS distinguished from the TTP by absence of neurological symptoms, acute renal failure and occurrence in children. These are the clinical features. They occur in young adults, more common in female than male. Thrombocytopenia, hemolytic anemia, that is characterized by fever, transitory neurological dysfunction and renal failure. These are the pentad of the syndrome which characterize the disease. In laboratory, we have reduced platelet function. PTT and APTT are normal. Urine analysis shows proteinuria and microscopic hematuria. Treatment, usually we administer corticosteroid, platelet aggregation inhibitors, surgical management with splenectomy and blood transfusions. That's all for today's session. We will meet with an interesting lecture for the next session.